Normal labor. The first topic is initiation of labor. During a pregnancy, uterus is growing in size in hypertrophy and in term of hyperplasia. Uterus is quiescent due to progesterone. Pregnancy is a progesterone predominant condition. But during labor, estrogen is predominant and fetal CRH is responsible for the initiation of the labor. At term, fetal hypothalamic pituitary axis matures. From fetal hypothalamus, fetal CRH is produced, and from fetal pituitary, fetal ACTH is produced. And fetal ACTH is responsible for the production of the fetal adrenal. And from fetal adrenal, main product is the fetal DHEAS that produces the estrogen, and fetal adrenal produces second component, that is cortisol. And these cortisols are responsible for the production of the placental CRH. Then a placental CRH also increase the help in the placental production of the estrogen and also stimulate the production of the fetal cortisol. And placental CRH also produces the interleukin 6 and prostaglandin. Now, estrogen is the most common estrogen in the pregnancy is the estradiol, and most specific estrogen in the pregnancy is the E3. The main source of estrogen is fetal DHEAS, that is dihydroepiandrosterone sulfate. Now, placental CRH that are produced from the cortisol also act on the uterus from decidua that release the PGF2 alpha and also increases the oxytocin receptors in the uterus that causes the increased intracellular calcium that hence increase the contractions, and also increase the estrogen receptors in the uterus that increases the stretch receptors in the uterus and increase the progesterone receptors. Now, placental CRH releases PGE2 from the fetal membrane, and oxytocin receptors and prostaglandin increase the intracellular calcium, therefore increase the contractions. Now, prostaglandins increase the intracellular calcium that causes contraction and increase myometrial gap junction that causes the coordinated uterine contractions. And also prostaglandin ripening of the cervix, that is softening of the cervix. What happens in the softening of the cervix? There is an increased water content, collagen breakdown, decreased dermatan sulfate, and start before the true labor pain. The main events happening before onset of labor is the lightening, that is also known as welcome sign, that begins after the 36 weeks of the pregnancy. Second one is cervix ripening and false labor pain. For labor pain to produces, the 3 P's are required, that is passage. Passage is pelvis, passenger is fetus, and push is the uterine contractions. And what is the uterine contractions? They begin or that pacemaker at corona, angle of uterus, right more than the left, and spread to entire uterus at the rate of 2 centimetres per second, and entire uterus is depolarized within the 15 seconds. The contractions are predominant over the fundus of the uterus. Now, intrauterine pressure. During intrauterine pressure, that is during Braxton Hicks contraction, the pressure is less than 8 millimeter of mercury. The contraction become palpable at the pressure of the 10 millimeter of mercury, and contraction become painful and lead to dilatation of cervix. The pressure is to be 15 millimeter of mercury. The fundus cannot be indented, that is moderate contractions at the rate of at the time of 40 millimeter of mercury pressure.